Hi, Dr. Saxena here, and talking about something about toxicity because whatever I've been talking about, I would like to these segments. I try to tell I've been talking about what are the endocrine disruptors and what is the toxins which are specifically attacking the endocrines and all that. Today's segment we'll be talking something on thing called neurotoxins. I believe neurotoxins are everywhere, and yet what exactly is known as neurotoxin? This is not properly defined. There was a some. It's a basically a poisonous substance that acts on the nervous system and disrupts the normal function of the nervous cells. This is the definition of the neurotoxin. Having worked in a field like autism, trying to work with a lot of neurodegenerative disorders, and which we commonly see sensory neuropathy, diabetic neuropathy, and we are trying to work on this particular thing. I thought, let me tell you what are the things we look or what are the neurotoxins we look in your day-to-day activity, which you may be encountering a few of many chemicals on a daily basis, and that is not just detrimental to the health of your brain and nervous system but as a whole, because whatever you keep doing, by the time you realize there is something, things are really get worse. I just want to talk about one thing called glyphosate, which is called a roundup. It's a basically used as a herbicide, and I can always tell you herbicide is found in most agricultural crops, which are like corn, which is something like soybeans and genetically engineered crops and grains. And this glyphosate is one of the reasons of the disordered brain chemistry. People presenting with anxiety, people presenting with diarrhea, dizziness, headaches, breathing difficulties, they may be having toxicity with this Roundup, which is the glyphosate. It can induce depression-like symptoms in people, and yes, we know that what was the class action settlement which was happened with the Monsanto, which they had ultimately paid that kind of thing. And this is one thing which is always I've been talking. Try to be careful with the corn, soya beans, and cotton. See, we need to look at all the labels and try to understand what is the thing which might contain this glyphosate. The second common thing which I try to look at as a neurotoxin is something like artificial flavor, sweetener, which is a aspartame. Aspartame is used in many low-calorie diet and sugar-free products, including sodas, sweets, and yogurt. You need to be careful about this. This causes injuries. This aspartame causes injury to the neurons of your brain. It can cause seizures. It can cause depression. It may lead into vision problems. It may lead into ADD, which is attention deficit disorder, and birth defects also have been thing. And prolonged consumption of this aspartame has resulted in something called dementia symptoms and memory loss in a lot of people. The number glyphosate is over. Second one is this aspartame. The third one, which comes to my mind, is something like pesticides, which is something. A pesticide is commonly used in all cotton, corn, almonds, and many fruit trees, including apples and orange trees. Chlorpyrifos is the commonly used particular stuff, which can result in seen as dysfunctions, which is manifest as headaches, nausea, dizziness. It can cause muscle twitchings, loss of coordination, sometimes with breathing difficulties also. The likely candidates who are most affected are the children, because I always have been on record. Children are the big absorbers because of the small surface area, whatever things and all that. This is, and that's a growing tissue. They are children with a thing. They are the most, they absorb this particular stuff like anything, and this may cause some neurodevelopmental delays as well as tremors. Always I cannot exclude one particular thing which is called aluminium. I have been talking in several forums trying to see Most of the people are hooked to this aluminum. They are not aware that they are using that aluminum cans. People, even the doctors are not aware that even the pressure cookers, what they are using is aluminum. Apart from that, there is a aluminum which is added in the vaccinations to make the more robust antibodies, and this is one of the which causes a stronger immune reaction to the vaccine. So this adjuvant is purposely added to make the more strong reaction, and children are more susceptible. I had seen lots and lots of autism cases. I've seen lots of fits. I've seen lots of cerebral palsy, where some or the other way, aluminum is one of the causes in that particular stuff, along with some other things also. So it is experimental research has already shown there is a link that there is an increase in autoimmunity, long-term brain inflammation, associated neurological complications that can be serious and last for a child's lifetime. So this is one thing which, for me, aluminium. Now we are talking about aluminium for from different sources, and we need to be careful about this particular stuff. The glyphosate. Then I started with you have got aluminium. You have got I was talking about pesticide chlorpyrifos, as well as sweeteners, sugar sweetener, which is aspartame. And the fifth common thing which I can always tell you is about the fluoride. Fluoride, it's found in the toothpaste, it's found in the mouthwashes, nearly all water beverages, including water, will have fluoride in that. And this fluoride is known to cause some arthritic symptoms and thyroid issues. But this high doses of fluoride, I haven't seen people using as what teeth whitener, and this fluoride, it can be, it is a potential neurotoxin. Take it from me, and it can affect normal development of the children. And see, it's the additive effect of with the more products used with fluoride acts as additive effect. It's given along with aluminium and other stuffs and all that. And the calmness thing today I was that made me realize I should talk about this is one of the patient I was dealing with. He has some neurotoxicity, his loss of balance. He presented to us with a young chap around 30 plus. His gait is swayed. He's not walking properly. And when I talked to them, there were 3 or 4 attendants who come along with them. All of them using synthetic fragrances. They are wearing the perfume. So the first thing I told them, okay, whatever is it, that reason that makes me work again. These synthetic fragrances, which are found in thousands of products, including lotions, perfumes, body wash, laundry soaps, detergents, even candles, they increase the allergies, they increases the neurotoxicity, and there's a possible relationship between the maternal exposure to the synthetic fragrances to the autism also. So all this neurodegeneration is probably these are the things which we have to be careful. And people really doesn't know the synthetic fragrance what they are wearing is affecting somebody else, or is affecting themselves also. They are not aware about this is a potential neurotoxic substance. And the last one, I'd like to finish with this thing called triclosan. Triclosan is there in almost all cleaning products. It was recently banned, but I still see triclosan in all the soaps, hand sanitizers, face wash, toothpaste, and all. And triclosan is one thing which contributes to antibiotic resistant strains of bacteria, number one. And it's linked to thyroid issues, it is linked to immune disruption, neurotoxicity, and cancer as well. So this are the neurotoxins which are resulting in an epidemic of nerve disorders by damaging and interfering with the functions of your nervous system. And there are many others, and then what is the kind of take what I'm trying to put across is, once we know there are some things, and we need to first you need to see that it's not used, it's avoided. Even if you were exposed with that, it is important to how to eliminate and decrease your exposure to chemicals for a lifetime. So this is one thing which we always do, trying to work on some our detox procedures. We try to work on some hyperbaric. We try to put the patient on nutrients which may help the brain health, like fish oils and all that. concentrated sources of omega 3s. I tell people to go with organic broccoli, turmeric, blueberries, eggs with good phosphatidylcholine. All those things supplemented with the diet can help this problems of neurotoxicity. And yeah, this is one thing which I always believe this we need to. I'm not an integrative. I'm not a neurologist, but my practice is mostly people come with autism and other stuff. And apart from that, we have been working off late with lot of Parkinson's cases as well as Alzheimer's and all. And it's my duty, like, because I have been always talking about this particular thing, neurotoxicity, and I would. There are not much integrative neurology doctors in this part of the world. So we try to work on this to try to first educate people that there are neurotoxins, empower them with this knowledge, and execute. They should start utilizing our nutritional things and all, and start looking at what is the thing which can be worked out. So I've been always talking about how what are the changes you do and how you can always work it out. The this treatment and part, I don't want to get into all that, but I can always tell you our process for detoxification, which is neurotoxic elements which are present always. And if I'm able to reduce that kind of oxidative stress by removing some of that, it helps it helps the body to start rebuilding itself, and that makes the difference. Thank you.